At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. My name is Donna R. I am the founder and CEO of the Global Liver Institute, and I have the privilege of being your host for GLI Live. I'm also a rare liver disease patient reporting for duty this February in my stripes, and I'm excited to talk about all things pediatric and rare. I hope you are participating in our #RareAware campaign that you can find on every social media platform but one. You can figure that out for yourselves. But today I am here as part of our discussion on transitions of care, which are fraught throughout healthcare for so many patients, but often go unignored. And particularly if you are transitioning from the bubble of a pediatric hospital to the wild, wild west of adult care, things can get, the ride can get a little bumpy. So here to tell us about it, I have two experts. Evren Ayik is with us, as well as Sophie Hansen. So welcome to the show. And Evren, I'll start with you. Why don't you tell us your story and how you got here?
Well, hello everyone. My name is Evren Ayik. I'm 22 years old, and I live with the rare genetic lysosomal storage disorder called acid-sphingomyelinase deficiency. So the disease affects my liver as well as one of the major symptoms, connecting me to the Global Liver Institute and being here today to share a little bit about that and my life and how I'm connected from my story from pediatrics to adult care. So I'm also from Merced, California, and I'm a college student, a senior at California State University, Fresno, and I hope to become a special education teacher to help students with disabilities and kind of just inspire them and have them learn from my story as well. So I'm thrilled to be here with you guys today.
Thank you. And as a daughter of school teachers, that just warms my heart to hear that goal. I know any of your students would be lucky to have you. Sophie, welcome. Tell us about yourself.
Yeah, of course. So as Donna said, I'm Sophie. I'm 21 years old, and I was diagnosed with a rare liver disease called primary sclerosing cholangitis, or PSC, when I was 3 years old. PSC is a chronic progressive liver disease that causes inflammation and scarring in the bile ducts of the liver. And there's really no effective treatment. So most people with this disease end up needing a liver transplant at some point. So I was put on the liver transplant list when I was 11. I waited about 4.5 years and was transplanted when I was 15. 6 years later, I'm actually waiting for my second liver transplant. But despite that, I am also a senior in college. I'm on the pre-med track at the University of Utah, planning to apply to medical school this year. I also work as a pediatric transplant research coordinator and do research with the hepatology team at the adult hospital. So yeah, I'm excited to be here. Thanks for having me.
Absolutely. Thank you. And we've already debunked a few myths. I remember standing in the aisle at CVS, where I'm often found, frankly, and someone said, "Well, at least children don't get liver disease." And I was like, "Wait a minute, that is not the case." And so that's one. And I think the other one that's even more striking is that I think people feel that you give up your dreams when you're diagnosed with a liver disease, or you give up your aspirations, and we don't. I was in law school while I was, waiting for and received my transplant, and went back to law school, and have been working ever since. And so I think that's really important. When people think about liver patients, they need to think about us, and we think about what we're capable of. I think they should think about the things that you have talked about, and the things that you're actively doing right now, being in school. So Evren, I'll come back to you. Usually your book is on my shelf. This particular shelf is usually reserved for books by patients and patient families. But I think my husband, who's a pediatric geneticist, has walked off with your book to show colleagues and others. So can you tell us about your path to becoming an author, and what you wanted to accomplish with the book?
Well, first off, that's super exciting to know that your husband has walked off with this book and is using it for his patients. So that's super exciting to hear. So all my life, I've wanted to write a book, and my mom and we put this book together. It's a little compilation of the story of my life living with a rare genetic disease. And we just compiled it together to share my story, to inspire children with rare diseases to just find their true unique identity. And your identity is not always found within your rare disease. There's many different puzzle pieces that make up your identity.
Mm-hmm.
So it's just been a great tool to give to children and their families to just learn and show and help them to find their identities. And it's also a great tool to share with the people who may not be familiar with the rare disease community. So whenever I meet a new friend or someone who may have questions about my rare liver disease or what I'm going through, I can use this book as a tool to really share with them. The book was inspired by my milestone of graduating high school. So that was during the time of the pandemic. So we had quite a bit of time to work on this book together, my mom and I. So that was just a great piece or acknowledgement from her, and together something we could do just to recognize my high school graduation. So
that's fantastic. Some of us were just watching YouTube makeup videos, and you were writing a book. So, thank you. Thank you for that. It is so important to have, representation of all sorts. And I think particularly for children with liver disease, or parents who are stunned by having their child have that diagnosis, and how is it going to change their family. I'm sure both yours and your mother's contributions for how to tell those stories and share it with others and make people feel less alone is something that is so important. One of the reasons why I love the book, and sort of almost, I can't prescribe things, but recommend them to people. Sophie, I love the fact that you're now involved in research. So maybe tell us a little bit about your path to becoming a patient researcher.
Yeah, so obviously my experience with liver disease and growing up with liver disease kind of inspired my career path and my path to becoming a researcher in the field that I am a patient in. I started doing research not in the liver disease field, in a completely different field, and I was lucky to have the opportunity to start doing research with my own medical team at my adult hospital, and I work with the research team there to write abstracts and publish articles in liver disease research. So I'm currently working on 3 different abstracts. I presented 4 at the liver meeting, and I'm just really passionate about doing research and advancing that field. So.
How did that conversation go, I think, is the question most of the watch, because that transition of physicians thinking about their patients as potential partners and peers and co-authors, how did you help them make that transition?
Yeah, so it was an interesting conversation. It actually happened at my transition appointment. My pediatric liver doctor knew I was passionate about medicine and was on the pre-med track in university. And she mentioned that to my adult hepatologist. And without me saying anything, he said, "Oh, do you want to come do research with me?" And I was like, "Absolutely, I would love that." So I went through all the steps of being like certified and getting my certifications to be able to do research and training and things like that. And so I'm very lucky to be able to work in both capacities with the clinic there and also be a patient. It's an interesting dynamic, but I really enjoy it.
It is. When I see former transplant recipients or pediatric transplant recipients who are now heading transplant centers, like at Johns Hopkins, that's exciting to me, both in the empathy that they'll be able to bring, but also the research questions that they would bring to the table, which are just a little bit different than somebody who isn't living every day, experiencing, around the clock. How does transplant or the autoimmune disease make you breathe, or your skin different, or 1,000 different sort of questions that may not be some of the bigger issues or longer. Or I know that this will be a long way for you all, so I'm starting to tell my age, but when after in an age of transplantation where there was a lot of use of corticosteroids, of prednisone, I needed knee replacements much earlier than normal, and I was wondering, well, how do joint replacements work in people who are immunosuppressants, who are post-liver transplant? And there wasn't a lot of information, because I'm sure the people who were asking that question weren't as connected to the research and the research question generation as you now have positioned yourself to be. So thank you on behalf of all of us.
Of course. Yeah, it's been interesting to have that perspective and be able to contribute in a way that's different than just the academic side of things.
And I'm sure for all of our patients who participate in our Advanced Advocacy Academy, understanding the certifications that they can gain to be able to do that more formally is something that we would want to add as we attempt to build that program every year, and particularly for the people who come back year after year and want to know more and what's the next level. I would think that is, having designed a lot of clinical trials myself and led research networks, being able to have a patient on the path and get the certifications for that, I think would be of interest to a lot of our A3 graduates. So, Evren, we've been talking about, there was the mention of a transition meeting, and like my heart almost stopped. I'm like, oh, an actual transition meeting. Did you have one? Not everyone gets one of those. What have some of your discussions around transitions of care looked like, and were they formal or informal?
That's a very good question. So my mom has been a major part of my life and my journey with this rare genetic disease, and she's just always been there for me and kind of guided me through that. So as an adult, becoming an adult and having to transition into adult care from pediatrics, it was really a big journey, and it was a big thing because I didn't really know what was going on at first, but now I think I have a great handle on it. So it was kind of scary because for me, someone with a rare genetic disease, my children's hospital would be willing to see me until I was 21 years old. So after I turned 21, we had to start talking to adult doctors. I could no longer go to my local children's hospital. And for me, I have an army of doctors, like for every organ and all that. So something interesting about that, I was going to a gastroenterologist through for my liver through the children's hospital, but then I had to go find a new one as I became an adult, and having to explain my whole story again and what I go through to the new gastroenterologist was a bit challenging, and he just didn't seem to understand what was going on, he suggested we go to a research hospital and find someone there. And we're used to people denying us and telling us that these doctors don't want to give it a try. So now I'm seeing a great hepatologist through UCSF, through my that's local, based in Fresno, where I live and go to school. So that has been quite convenient. But just going through changing from pediatrics to adult care, was for someone like me, it's really hard to go find a whole new army of doctors. And yeah, so that was a big challenge for me.
I think that's something that is not often recognized. You'll often see in print, well, get your care team, and putting all of those specialists, finding all of those specialists, vetting them, making sure that there's a good fit in both expertise and personality, but then having them acknowledge that they're actually a team for you is a different step entirely. And so it's one of the things we recognize, certainly as a patient advocacy organization, but often when we're reading materials and reviewing them or working with other partners, it's sort of like, well, just put together, just talk with your care team. I'm like, just who are you talking about? Because it's a lot harder in practice than they would like to make it. Sophie, a question I'd love to ask you, carrying over from another GLI Live that we have had this month during the Rare Aware series with moms who, were sort of white knuckling it as their kids were going off to college. And so how have you helped your family adjust to you, being a patient, but being a student and going off and doing all of that?
Yeah, so my mom especially also is very involved in my care. Very wanted to help me with everything. And honestly, I think it was harder for her to transition than me because she wanted to be involved in every single step. And both doctors were like, okay, she needs to figure out her own care and be able to do it independently. So luckily with my kind of background and interest in medicine, I didn't have a super difficult time transitioning and was super lucky to have a very well set up transition process through the hospitals. But yeah, I think especially insurance and pharmacy, medication, switching things all to me doing that, me calling and setting appointments, making sure the phone numbers were switched so my mom wasn't getting called for everything. It was definitely a process and not an easy one. But yeah, I was lucky to have a great team helping me through it.
There's more steps than you think to uncouple or transition. I think the top two questions were, will they take their meds? Yes, we take our meds. And when we drink ourselves to death in college, no. And so with those two things answered, but we have to find that out for ourselves and determine what we're going to eat in the dining hall. And so, Evren, what do you eat in the dining hall? I ate a lot of cereal. I'll just admit it that I ate a lot of cereal in the dining hall in college. And
what Sophie is saying is all very familiar about making appointments for myself and things like that. So my first year was all online, so I got to go to college online for a year, and then the next year, I moved into the dorms and ate at the dining hall. I'm a very picky eater. I'm not going to lie. That's been a challenge for me, finding stuff I like to eat that's healthy for my liver. So that has been a challenge. But yes, the dining hall does have some nice options. And yes, but sometimes I got tired of going to the dining hall and just wanted something else from off campus. But yes, that's something that I'm trying to work on and be better at, is finding healthy options that can be more healthy for my liver.
But you it's a problem that you're solving, and I think exercising that muscle of problem solving. I sometimes feel bad for people who have, been healthy for all their lives. I'm like, oh, you don't have any skills. You don't have any tools to cope with this. Something's bad is happening to them when they're 60s, 70s, or 80s. And for the first time, I'm like, oh, you're upset because like this is just, you don't have any tools for this. I'm like, oh, okay. So I think of it that way. We've been problem solving, for years. And so, you're just getting started, and it gets easier and easier the more that you do it, and I think it really sets you up for success, a successful future. Sophie, what things have you sort of had to sort out, as a college student?
Yeah, so I'm lucky to be able to live close to home. My college is close to home, so I still live at home, which I'm happy about. I don't have to pay for dining hall food. I get home cooked meals, and the one downside is commuting, but it's not too bad. But yeah, I think the hardest thing, like I mentioned, is just learning like how much is involved in aspects you weren't ever involved in, especially insurance and getting things approved. And sometimes like transitioning my care, my insurance wasn't covered at the new hospital. So I had to switch insurances, and then just advocating for myself because the adult world isn't set up to handhold as much as the pediatric world is. So they don't call you to remind you every 5 seconds to get your labs done or to refill your prescriptions. So it's been a challenge to figure that out. But once I figured out college and got everything set up, it was definitely a transition period, but I think I have it down at this point.
I think you do. So what types of things would be helpful but respectful, like enough but like not too much? So a lot of my transplant medications are on auto renewal and things from the pharmacy. What things would be helpful?
Yeah, so definitely that, making sure everything is on a schedule and set up so you're not going to the pharmacy every 2 days and everything on the same schedule. Help from, I think one thing that's helped me is getting to know my team very well. So knowing my nurse coordinator, knowing who they are and how to reach them. So I'm not like going down the phone line of a million people.
Right.
That's been super helpful, and just making sure everyone knows like my history and like my expectations for my care, so I don't feel like I'm left behind or left out of decision making, has been helpful for me.
That's fantastic. One thing that I learned to do was in order to minimize blood draws, was to sort of collect, lab, like who wants labs. I see an appointment, coming up this week or something, and I'm like, okay, who wants labs? You want a Prograf trial, you want a CMP, you want you want a special rare autoimmune thing. I'm like, okay, let's collect them all up and ask whoever is doing the blood draw. I'm like, can you run all these things for everybody and send them back out to everybody, so I'm not running all around like a pin cushion, with nonsense. So in this year of 2024, when my personal hashtag is make it make sense, that's one of my top tips, because they would just have me do random individual labs and I wouldn't have any veins left. Evren, what are some of your tips or tricks for navigating or pulling together a team?
I love that you mentioned about the labs, because that's something I do too. I do not like to be poked. I already have to be poked once every 2 weeks. So to minimize that, and just the whole patient portal thing where your doctors can see all your lab results all together. So getting the patient portal set up is a great process, or finding somewhere where your doctors, your team can access the patient portal. So that's just been a great tool for me. So all the doctors can see all the informations, like all the tests and all that, all compiled in the patient portal. So That's
And
something
I think that that's important time for people and families to invest in, is signing up for the patient portal. You may have more than one if you have sort of multiple health systems or a mix of academic and community doctors, but that sharing of data and then things I used to have in like a little diary or written down or a spreadsheet or something are all now in the portal. And it's why we, have started having digital health ambassadors to help people, sign in. And of course it makes research, better. But what, I'll turn this back over to Sophie. What electronic tools, or are there any apps that have been helpful to you? Or, you talked about insurance, issues. Are the insurance websites helpful in any way, or how can those be improved?
Yeah, so I think technology in the last few years has definitely progressed to a point that it's actually helpful for patients, especially like Evren mentioned, the patient portal. I find that often I'm the one who sees my labs first or anything, and I like that I can bring up any questions I have to my doctors or point out things that maybe they didn't even see in results or imaging, things like that. I would absolutely not be alive without like a reminder app for my medications that I have to take. I have like multiple alarms set on my phone, and also an app that keeps track of all the dosages and everything. Reminders for refilling prescriptions, appointment reminders, all of the things that get complicated with rare diseases and managing that care. Insurance portals can be helpful. I think that's one frustrating thing, is sometimes you just have to call and wait for a long time to be able to talk to someone. But I found that like getting over the fear of talking to people on the phone, which I think is something a lot of young people have, has been especially helpful, because sometimes you just have to do it and call someone. But yeah.
Absolutely. One of the things about, reminding to take, medications, I have found that more. There are certain ones I take up in the morning. I take in the morning when I get up. I take sort of when I eat, and then I take before bedtime, and trying to tie them to behaviors rather than specific times. Particularly since I travel a lot now, and I'm trying to like when do you take this at sunrise? Well, the sun's risen 3 times, and so the time has changed, and I'm in a different time zone. How does it? And so tying into different behaviors has kept me on track these years. And so if that's helpful to anyone, I'll make that suggestion. And I haven't missed a dose in forever. In fact, it's very hard for me, and I have to tape everywhere to like not take my Prograf on days when we're going to test the Prograf level, because it's so inculcated in me to like just take it first thing in the morning, that to not take it takes special reminders. I also wanted to just ask you a little bit, and want to make sure that we were helpful if we can be, as you face the prospect of having a second transplant. So what are there things that you wish you knew, or that now, in getting ready for a second transplant, that would be helpful or are helping this second time around?
Yeah, so I think one thing that kind of surprised me is going through this, growing up with the rare disease and PSC specifically. I, as a small child, wasn't super involved in my actual medical care. And so I didn't really understand everything that went into the care and like exactly what the disease meant. So I kind of had to learn to research it myself. And honestly, when I was diagnosed a couple years ago with recurrent PSC, I didn't even really know that was a thing. I thought I would get a transplant and be fine for pretty much my whole life. So it was kind of a shock to even learn that was something that was possible, and something that probably was discussed with my parents and doctors at the time when I was little, but I wasn't in on that.
Right.
So I think education for patients who grew up with diseases or were diagnosed at a young age, who maybe don't fully understand like the gravity of the situation or what is involved in care, either after transplant or just as an adult growing up. Going through the transplant process for a second time is so completely different than it was the first time. Like, I was 11 the first time I went through it. So instead of like going through the appointments by myself, I was with like the child life specialist playing games. So it was like a fun process. Whereas now it's like kind of lonely. And
could we make it more fun for adults? I'm not opposed to fun. I get a little jealous when I walk through the child rings. I'm like, I'd like some color in the other part of the hospital.
I agree. They should make it fun. We should have prizes for sure and snacks. I think that would help.
Always snacks. I'm a big fan of snacks.
Yes. So yeah, it's just been a different process navigating it as an adult, but overall, I think my team has been great in helping me get through it for the second time.
I think that I want to make sure that a really important point that you raised amongst many is people sort of take away, doctor people. Just because you told me that, at age 3 or 11, or for me, like 29 years ago when I first had my transplant, does not mean that you don't have to tell me maybe again every decade or so, or when I get a new doctor, feel free to, even if you think I may know, tell me, information may be updated. It may be new. It may be, guidelines or standards or screenings may have changed. And so feel free to tell me again, what you need me to do or what tests you need me to have on, and how my testing schedule is different perhaps than what would normally be, for my age. Don't just, I appreciate that you think I know a lot of things, but like, feel free to jump in and tell me those things again, because I may need to hear them again. So Evren, I'll give you the last word. Just what would you like, so rare liver disease patients, but particularly those who are diagnosed and living with it as children and young adults, to know or to keep in mind as they move forward?
I would like patients who are rare liver disease patients just to know they're not alone. There are other of us too who have gone through this battle or journey, and I know I'm willing to answer any questions that they may have, and so they can learn from my story and just these helpful tips that GLI and this helpful GLI live event, they can come and learn from this. And so that's super exciting, and I just want them to know that they're not alone, and there are great organizations like this here to help and learn from.
Thank you. Couldn't have said it better. Thank you both so much, and thank you to everyone listening and watching. Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.